Well, again, I want to thank the panel. Bob did have to catch a flight. He did ask me to mention that Meredith Ponder is here from the coalition. Could you come up, Meredith, so that if there are questions for Bob or about the coalition, you could respond to those? If there are questions, we would like to entertain them now. Please go to the mics at the back of the room or raise your name tags. Alex.
Thank you for a very stimulating panel. And I would like to go back to you, Marie-Thérèse, because you have mentioned about ambassador champions to be innovative. And quite frankly, I'm not seeing this innovation. I'm with you. Would like to see that there would be thinking out of the box. And I'm going to mention one name here. I haven't been paid to do this, but Jane Fonda has written a fantastic book about aging. She calls it the prime act. It is the final act of her life. And as an actor, she says that it's only when you are on your third act that the events in the first and the second act in a play will start to make sense. Perhaps that is what you also need. You have plenty, not only within the United States, but you are influential in culture throughout the world. And perhaps to cultivate ambassadors like Jane Fonda, she has a lot to say in this book about abuse, and abuse from a life course perspective. It would be very interesting because if there is one thing that I feel we have not covered well in this conference is the gender perspective. Now and then we mention about women, but not enough. Not enough to show that they are the major victims. And if you can identify in this incredibly vibrant society and culture, some ambassadors, we would all benefit from that globally.
Yeah, I agree completely, and I think on both points that we critically need good ambassadors and that it is a gender issue. Another person who has been talking about the issues of women and aging is Gloria Steinem. And my personal view is that this issue will probably not take off until, as a movement, until the women's movement reaches that age. And I think she's right at the forefront. Yeah, and so I think she might be a very promising person to cultivate. But I completely agree that we really need to be thinking about who are going to be great spokespeople and ambassadors.
Jim Mercy.
Hi. Patrick just told me that the headquarters of AARP are right across the street here. And I'm just curious, not knowing a lot about this area, where the AARP is on this issue.
Well, an initial caveat, my husband works there, and I would say that they're doing a whole lot less than they could be. And the problem is that the perception is that AARP equals aging advocacy. And that isn't so true with the most vulnerable of older people. And I think actually there's probably a reason for it. And that is that they want to portray aging as a good thing and as a positive event in our lives, in our life courses. And so it is, I would think, perhaps fundamentally inconsistent with the message of aging that they're trying to portray. And I'm sure others have views, possibly even some AARP alums who are in the room.
Well, I'm very literal. It says push here, and I pushed there. You know? Okay. That being said, it may be true from your perspective of the bigger overarching work that they do. And I'm not really going to speak to what they are because they're an association of people who joined. And they lead a constituency where I suppose they feel that wants to go. However, on the other hand, they have been very supportive of these issues, the international issues. They're a partner of ours. Recently, we do work with them every day almost, with the international office that works with us. They're part of our global coalition, and the money that came for this survey that I'm talking about was given by, is it Deborah Whitman? Is she the new Whitman? Yes. But she worked in the Senate Aging, and she gave us a lump of money to do this survey and to hear the voices of older persons around the world. So we're very grateful to them for that, because we've been working on nothing. You know, I mean, you think government works on nothing. I feel your pain. We've been working on nothing, and this will help us. But we've been partners in the open-ended working group. I worked with Jessica Frank and Alex, and we work hand in glove every day, every single day.
Having said that, Susan, we have to agree that when you were showing your pie charts of 0.001% and so on, I mean, what AARP has been given, both to international global aging or to initial like elder abuse, is probably less than 0.00001%.
Well, that may be true, but they're not a government entity. I thought that was government.
We have time for one more question. David?
I have a question to ask, and I'm a representative of the Federal Trade Commission, but this is really just a question that comes out of something that was in the Elder Justice Working Group, that an article that Stacy Rogers presented to me that raised an issue that I'd like to ask MT, and, well, I would have asked Bob Blancato, too. There was an article which appeared in 2009 that was very critical of public education directed toward the elderly, of awareness of all kinds of frauds and things. And I wonder what your thinking is, MT, and to the extent, you know, Bob's representative is willing to comment on who public education should be directed at, forgetting about the content, but should be directed at the vulnerable elderly, should be directed at caretakers. How should it be directed? I wonder what thinking you have on that.
I'm not sure I'm the expert on this, but my view is that the FTC and the CFPB and other organizations that do a lot, and AARP actually has done some of this kind of education as well, need to be working with the likes of Dan Marson and Jason Karlowish on fashioning messages that resonate with financial capacity, that are capacity appropriate and age appropriate, and we should be targeting both. We should be targeting younger people, caregivers, family members. I guess that's more than both, a lot. But I do think that incapacity is required, or the rise in older people who are going to be suffering from some kind of cognitive incapacity requires a fundamental rethinking of what consumer protection means, and how we do that balancing of autonomy and safety. And, you know, so I actually think that it would make a lot of sense for those of you who are involved in that business to be working with the experts and to start thinking about how to do that.
Thank you.
Well, and I would also agree with that, and I know that Bob would as well, insofar as that it makes sense to target different messages to different audiences. And I know that Bob has been a very big advocate of getting the word out directly to affected audiences about elder abuse, about things to look out for. I know that in Bob's capacity as the executive director of the National Association for Nutrition and Aging Services Programs, that he has advocated on behalf of having elder abuse awareness programs at congregate meal sites and that kind of thing. So having abuse prevention, both for vulnerable elders and also for their caregivers, is exceedingly important.
Well, thank you, and let's give this panel one more round of applause. And thank you, Meredith, as well.